Welcome to Boombostic Health, where we challenge the business of healthcare and explore bold ideas that drive meaningful change. Each week, we bring you candid conversations with top experts, innovators, and leaders, exploring the latest trends and technologies shaping the future of healthcare. Join us and be part of the conversation in transforming healthcare. Hey, everybody, and welcome to Boombostic Health in the Wild here on location at the JP Morgan Healthcare Conference in San Francisco. We are in the Palace Hotel. I'm here with Emily and Chris, and we're planning to talk a bit about our observations of the JP Morgan Healthcare Conference. But first, I want to thank our partners at Ziegler for allowing us to use their conference room as our makeshift studio here. So Chris and Emily, they've been here braving this conference with me. There are thousands of people descending upon San Francisco this time of year. And we wanted to talk a bit about some of our observations, but also get into the fact that there are lots of investors here. And the investors like to talk about the businesses they might invest in and dissect them. And so we're going to kind of turn the tables and dissect the investors a little bit. But with that said, I'll start with my first observation. This is the nicest weather the JP Morgan Healthcare Conference has ever seen, possibly. I remember the last time I was here, I went in to buy an umbrella and walked out and it literally turned inside out. It was raining and so windy, and it's like sunny and I don't know, 50 degrees.
Yeah, it's pretty cold. I have my jacket.
Parka weather for you? Weather. All right. Well, what do you think, Chris?
It's a nice change from Indianapolis. It is beautiful.
For sure.
I was here with you during those monsoon rains, and I think some of my clothes are still wet from that time.
Yeah, no, it was crazy. So in terms of the just general observations I'll make also, there are Waymo cars driving all over the city with nobody in them. And it's not only there's no driver, but there's like no passenger either.
I was late to a meeting because I was so taken aback by this robot car. And I was outside taking pictures of the car, and the people that we were meeting with definitely walked up behind us and saw me taking pictures of this car, but I was perplexed. And then the other thing was the car actually stopped traffic because everybody kept walking through the crosswalk and it was waiting for everybody to stop. So the cars that were driven behind with actual people in them were just laying on their horns.
Oh my gosh.
Yeah.
That's so interesting.
It was interesting.
So that's kind of a blind spot.
It is.
Should the car be able to honk and yell at people to get them to stop going?
But when people cross in front of it, a little pedestrian crossing symbol goes up in that like circle thing on top of the car.
We learned something not to do today from one of the investors, and that is do not fall asleep in a Waymo because the car will not wake you up.
Oh my gosh.
But that you will be awoken because emergency services will be called and they'll be knocking on the window.
The cops will show up.
Yes.
And when you are drunk and passing out, which I think is probably what happened, it's totally the
I claim they were
engineers.
very tired, but I'm not sure.
The engineers should add some kind of feature though, where it like gently wakes you up, or maybe like
Sort of like a sleep.
Yeah, like an 8 sleep.
Like an 8 sleep.
Like
yeah.
my 8 sleep, which is I absolutely love. The 8 sleep is this like bed technology. I think I've told you about it. And it is designed to biosense everything. And so I've got my Whoop band telling me one amount of sleep, and then I've got my 8 sleep telling me another amount of sleep. Both of them are conclusive that if I have anything to drink before bed, it makes me sleep worse. That's kind of the biggest takeaway. But the other part is if you want to use it as your alarm, it'll start like vibrating really gently to wake you up, which is kind of awesome. It sets the temperature based on like what your exact preferences are in terms of when you first get in bed. And then, as you go through the night, it changes. And in the morning, it actually like drops the temperature. So it's vibrating you awake and cooling you off. It is the coolest thing. So they should do that.
They should.
Waymo.
Yeah.
That was a commercial for 8 sleep. Those of you who don't have 8 sleep and you've never tried Waymo, consider it.
So now you'll soon observe the vibrating Waymos and getting to your destination.
Right.
With your
This changes everything. That actually, you're welcome, Waymo. That's if you need product requirements. We've never even been in one, but we see them and they're driving around, and it's really fascinating. It actually reminds me of the movie Total Recall. where do you remember Arnold's character gets into the like Johnny cab, it's called?
Oh yeah.
And they're self-driving, but they have like these little guys called Johnny that are little robot guys that are driving it. And I'm pretty sure Arnold like punches the Johnny cab and like tears it off because he needs it to, drive faster or something. But that the Waymo is bringing that to life. So we ultimately owe all of this to Arnold in some way.
And we're in California. I
Yeah,
feel like
he
that's
needs, he needs to take credit for something else.
Exactly. And we're in California where Arnold was the governor. So, okay. So those are general observations about the JP Morgan conference. Also, there are lots of blue suits.
But
I think probably the ratio of blue suits to any other garment, it's probably about 99-1.
Yeah.
Do you agree?
Mhm.
So I shook it up today and wore my red quarter zip in honor of the IU Hoosiers, which, as I do admit now, I played football there because we're, a great football team now. All right. Well, getting to the more serious aspect of the conversation, we build companies in the healthcare industry. Emily works with companies that are being built in the healthcare industry that use private equity and investors to capitalize those businesses. And when you're on the side of the world that we're on, which is generally attracting new investors to co-invest with our Health Cloud Capital Fund, they ask us a lot of tough questions, and they're trying to size us up and decide if we're the kind of business, whatever that company is, that they want to work with. And it got us to thinking, like, well, what kind of investor do we want to work with? And, first of all, I will say that we do have a no assholes policy, and that applies universally to people that might be on our team or partners or customers or also investors. And thankfully, we've met a lot of really cool investors that are here at the conference. Chris, you had some interesting observations that we were talking about earlier. I'd love to hear your thoughts on what makes a great investor for the kinds of innovators that we're backing and that the innovative companies we're building in healthcare.
yeah, I think as much as investors are trying to pick the right investment, I think as a company looking for investment, you're looking for the right investor that you want to be part of your team. So one of the things that I found most fascinating is telling our story or telling your story of founding the company and how it was created, but also hearing the investor story. Like, how did they get associated with the firm that they're in? What are they passionate about? What really gets them excited? And more than just bringing money to the table, how are they going to facilitate taking the company on like next leg of its journey?
Yeah, that's a good point. So Emily, who's more on the legal side, you see a lot of companies get backing from private equity or venture capital. Are there any observations you have on the situations where things go really well and what those investors do really well?
Yeah. So I think where we've seen things go better is when the investors actually have an understanding of the business and actually work with the folks to have that understanding so that it can help the company achieve the next level of success. Oftentimes we see folks invest in companies because it sounds like a good idea. They don't really understand the business model, and they don't, other than the initial capital, they don't bring much to the table as far as making the company succeed in a different way.
Yeah. Yeah, I would echo that. So a lot of people have money, it's insane how many investors there are. They're everywhere.
Yeah.
Like when we're raising capital and we have a deserving company, you can line up infinite number of meetings. But you find that some of those investors can say, hey, this reminds me of an experience we had in this other company, and this is what we did to actually take that to another level. And so you've got somebody at the table with you who's super valuable, as opposed to an investor, for example, and I had direct experience with this, where they put somebody on your board and you're trying to create the miracle of building a startup, fund that startup, and that person shows up to every board meeting and brings up all kinds of imaginary ways that people have conflicts. That is not helpful. If that person's on your board, do as we did and make sure that they find a way to get off of your board, because they literally will jeopardize the very existence of your company. It's the opposite of adding value. Not that I'm emphatic on that point, but I'm very emphatic on that point. So in addition to that, we find that there are certain investors that I think are more like listeners and then others that are like kind of in transmit mode.
Mm.
And I don't know. I mean, we had one conversation where, well, I guess, can you call it a conversation? We had a monologue experience.
We spoke and they sat there and didn't say a word.
They did.
And it really, those types of, there's not a conversation. It's kind of a one way. And it's really hard to get to know that investor and to know, what they're going to be like in the boardroom in a stressful situation when things are not going perfectly. But those that really, I think, listen and engage and really are curious about what you're doing and how you're doing it and why you're doing it. Those are I think the meetings that just fly by, and you get a chance to really understand what makes that investment team tick. And you just get so much more out of those than the ones that come in and either don't say anything at all, or they come in and they start firing questions, like on page 5 of the prospectus, you did this, and this number went from here to here, and they start digging in with those detailed questions without listening and understanding. It kind of sets the tone for you.
Right. Yeah. So you're on the defensive instead of sitting there on the same side of the table to sort out where you want to go forward.
Yep.
So there's a lot of consolidation happening with these investors as well. Some are like specialists in making acquisitions. And I know, Emily, you've got some clients that fit that bill where their PE partners have come on board to help them consolidate the market. And lab is a huge place where that continues to happen, for example. But when there's like all the final stages of getting a deal done, and you're into those final details, like how much do you see the investors even participate in that step? Or is it really the management and the investors in your experience are just like on the sidelines?
In my experience, they're typically on the sidelines. I mean, I think, especially in lab and pathology, this is what I say, a lot of the investors don't necessarily understand the business. It's pretty complicated. How most people in the medical industry don't understand the difference between like non-patient facing providers and patient facing providers and what that means. And so we see an influx of capital. They might be on some of the calls, but as far as like structuring the deal, going through diligence, creating the corporate structure, they're not part of that until an issue comes up, and then they want to know about it and how it impacts their risk.
Yeah, right. Okay. So those I think are probably also the right kind of investors where they're not necessarily meddling with the leadership, but they're behind the scenes cheering them on and providing support as they need it. So there's this concept we talk about called a spreadsheet buyer. And this is an investor who has some type of really super smart model they've developed, probably an MBA school, and they run all your numbers through it. And if it puts out all the perfect ratios, then they're really excited. And if not, they're not excited. And I think it's a great luxury if you can just use computers and spreadsheets to create a return. Typically, those investors are trying to make their money on the investment versus on the value created after the investment, in my experience. And those are typically a great fit with like innovators, because you have to make some moves, place some bets, and the numbers are only going to tell this ideal story down the road as your investments start to produce the desired outcome. That's something that you've seen.
Yeah, I think the spreadsheets, they tell you about history. They don't really tell you about the future, and they don't give you a qualitative assessment of the team. I mean, any good investor is investing not only in the concept of the business, but in the team that is building that business. And those spreadsheet buyers, they're really discounting the value of the humans and the team that they're investing in. And they're just discounting so many different intangible aspects of the business. And that may work for them, but it's really a very, it's kind of a closed-minded way of investing, because all of those intangibles are what really contribute to the great businesses, the timing, what's going on in the market, and all those things. So the historical spreadsheet may not show any of that. So
Right.
I think we tend to weed out those investors pretty quickly, and they get a first meeting, but not a second.
Yeah. So in summary, in terms of great investors, those folks that understand the business that you're in, that want to help create value on a go-forward basis with you. And so they're going to be willing to understand and analyze the true value of what you've built to that point on that prospective basis, not here's what you built. And so what's the rearview mirror say that this should have been worth? also understanding that as the entrepreneur or the operator, you want investors to make money. And so overpricing, overvaluing your asset is a bad idea because you end up in a tough situation down the road where it has to be, revised downward, and maybe you do a down round, and that is very unfun for everybody. But I think those investors that can help you think through and execute and bring in the talent and strategies to go take that next leg of the journey, they deserve to share in the value.
Yeah.
And that's not just a spreadsheet exercise. It's a much more comprehensive approach than that. And thankfully, we've been having a number of meetings here and met some great people that certainly could bring that higher level of value. So shifting gears a little bit, there are like certain themes that I've heard something about while I've been here. Leading off with one, certainly a lot of emphasis on AI, but specifically applied toward how you could analyze different populations. Like we met with one individual today that has a cool company doing like social determinants of health. So they're looking at things like food access and all kinds of constellations of information that are helpful for health plans. And they were even saying like a lot of major corporations were using it for their analysis of their employees. Any trends that come to mind that you've seen?
Well, I think the one trend that's clear is data. Healthcare is probably the most data-intensive industry on the planet, and the advent of AI certainly helps you do things with that data in ways you never could, and do it faster and in a more robust way. But those that really understand the complexity of healthcare data and can harness that, and I think that's one of the themes that we keep hearing about. So for our business, I hear a lot of investors valuing the fact that we've had a data-driven strategy right from the beginning. So it's nice to get that validation that all that hard work and time is really going to pay off.
Yeah.
We've always believed that it would, and I think we're hearing that.
Yeah, no doubt. And it takes time to build all those highways, but once you have them and the data's flowing, the sky's the limit. Emily, I know you were talking yesterday about some of the conversations you're hearing that show these patterns across the country from a provider perspective that CMS and other payers are paying attention to. I mean, while we're building generally data and technology companies that don't get reimbursed by insurance or Medicare, a lot of other folks are out there in the provider space building businesses that do get that reimbursement, and they have to consider the potential challenges there. Like, are there some themes that you're seeing or hearing from other folks around here in that space?
I mean, from the provider side, yeah, I mean, folks are going through a lot of investigations. The government is particularly aggressive, which I think if your operation or organization is not doing things compliantly, probably makes you less attractive as a target for investors. But the flip side of that is the government is using data too, right? They use data analytics to analyze reimbursement trends, to target particular providers who have an uptick in certain claims being reimbursed. And that's how providers get on the government's radar. And that's how audits and investigations start. So we see a ton of that. And we've seen a huge increase in the last 12 months of CMS and other commercial payers being really aggressive in trying to recoup money.
So they're looking at analysis using analytics and other tools that tell them, hey, this looks like an anomaly that shouldn't be looking this way, or is somebody getting paid in a way that they should not be? And then trying to go get that money back.
Right. Or you coding something improperly. You billed, 200 UTIs last month, and now all of a sudden you submitted claims for 5,000 this month. What's going on?
Right. Yeah. Another big trend that I'm seeing is this acceleration that COVID created toward more remote kinds of healthcare. And one friend that I came across, hadn't seen in years actually, has a really cool company that is dealing with management of patient information and patient care plans in a manner that requires technology to automate those care plans, which ultimately results in a more efficient way to ensure that patients get to a good outcome when they're in their homes, they're remotely managed. So I think telemedicine, remote monitoring, remote management of care plans, those are all areas that seem to be big trends at the conference here. Also, the fact that one beautiful part of the Ziegler experience they've got this amazing service that brings food and beverages and, caffeine. And right now they're doing their good work of getting that refreshed, which we appreciate, and also might introduce some additional noise. But on that note, we've set up this makeshift studio and we're okay with it because, we're in the wild.
Yeah.
This is the way that it goes. It's great to be here at the conference. So many smart people, certainly a lot of security as well out there, given some of the recent issues. And that reminds me, one thing that our Uber driver, who was a retiree from some seemed like white collar job, he said, "Why are you here?" And we said the healthcare conference, and he immediately said, "Why did my premium go from $600 to $1,600?" He's like, I don't even go to the doctor, and when I do, everything's great, and it's just for physicals, no medications. And that just highlights that this emphasis on how you can shift the payer orientation to where on the front end the patient is more aware and the costs are more transparent, that's like a big trend that needs to get solved. Right.
Yeah, there's much more awareness of that.
Any other interesting observations or trends or what the best investors are? I mean, the best investor is the one that says, you are amazing. We will take whatever valuation you propose. And, but, reality is.
Where do we meet them?
Yeah.
So it's sort of like speed dating. So I guess I'm going to flip it back to you guys, right? And you have these meetings set up all day long. What differentiates and what are the qualities? Like if you're dating, right, it's like somebody who's smart and has good personality, makes you laugh, blonde hair, blue eyes, all of the things. What exactly are those main qualities that you're looking for that you can identify in a 25-minute meeting?
I'll take a shot at that. I think someone that is curious and a good listener, that is really understanding the story, and is not just focused on kind of the next step in the process, but really wanting to understand what's made you passionate about building the company that you are and what's made you successful, and really just developing a rapport and relationship. Those are the things I think that really set those investors apart. Those meetings, they go like that.
Yeah. And I'd say to that point, there's one investor I can think about that we just met with recently who said, this reminds me of a company that was able to provide a service level to health systems to provide better patient care and also leverage insights from the data to create more value. And it was so analogous to what we were doing. And that person also understood the specific area that HC1 is working in laboratory, lab insight. And so it was like, this person gets me, they get us and they know how to help us. And so we were able to start the conversation halfway through what we normally have to say, because we didn't have to build all of that foundational knowledge. So I think after you've been at this long enough, you realize the money is the commodity. It's that connection. And some of it also is just intangible. Do you click?
Yeah.
You talk to the person and you're sort of like, I don't think I'd want to be in a board meeting with this person. And they probably feel the same way about you. And that's okay. It's about making that correct match. So, well, it's been awesome talking to you guys. Thank you, Emily and Chris. Thanks to the Boombostic Health community and all of our friends of the podcast. We'll be doing some other Boombostic Health in the Wild podcasts here from JP Morgan. And until then, have a great day. We'll see you soon.